Oh, I think it's brilliant. They phone me up and they say, how many syringes have you got, Mrs. Stevens? And I'll go and I'll count them. I know it's a particular day, and on the day I ring up and then they will give me the 2-hour slot. So I know what's going to happen, where and when, and I can go shopping then, can't I? It's just like as if you're making a cup of tea, you know, it's routine and it's always there. And I can rely on it.
So Homecare is another way of getting your medicines. So what we actually do is we contract Homecare providers to deliver and dispense medications on our behalf to a patient directly to their homes.
I think Homecare is good because it means that patients don't have to wait around in busy waiting areas anymore. They don't have to wait for the pharmacist to screen the prescription. They don't have to wait for us to dispense their tablets, and they don't have to wait for us to give them to them. There is a cost benefit. The drugs that we buy into the hospital cost more money than if we actually get them delivered to their home, so it's better all round.
It benefits clinicians specifically because we've had to rethink how we're providing care for our patients. We find that when patients come in, they've not already had a long wait to be seen and they're not facing another long wait. A lot of my patients, they have cancer. They don't want to spend all their time there. They want to be at home and looking for quality of life. So using Homecare has allowed us to basically rethink how we treat these patients.
So we could contact them and talk to them if that's useful.
We are seeing an ageing population with more complex illnesses. We're seeing an introduction of new medications which are often given in this way. We need to find a way of delivering and managing these patients' medications. I don't think general practice is up for this. I think the hospital system, it means an awful lot of traipsing for the patients. It's much better, we are in the 21st century, to have a more sophisticated, sensible system. We get most of our things delivered at home now when we need them. Why on earth do we have to trudge over to our GP or to the hospital pharmacy?
Homecare can be divided into 3 areas. Low-tech and mid-tech are essentially medicines that a patient can take orally themselves or administer simple subcutaneous injections at home. High-tech are slightly more complicated medications. This usually requires a nurse to go into a patient's home to administer these medications. Patients will have a delivery like normal, and a nurse employed by the Homecare provider will go in and administer these medications.
We can't do this ourselves because it's better that a company that's much more experienced than the hospital trusts, that they can deliver these drugs to the patient's home in a better way than we're able to.
Using home care companies actually provides the ultimate quality improvement plan, in that we've improved the pathway for our patients, we've improved the care that they're having, we're resulting in happier patients, clinicians are being less stressed in clinics, and we're also saving money, so it's been a win-win-win situation.
Oh, she likes that necklace, you know.
I know.
Because it's good for my well-being, isn't it? You know, I know that if I've got my injections, I'm a free spirit.